Tuberculosis is a deadly disease responsible for millions of deaths in the developing world. Now, an estimated 90,000 Ugandans reportedly contract the disease each annually despite of the efforts to combat it. Let's hear more in this report.
TB is highly infectious and can be spread through the air when an infected person coughs, sneezes, or talks. With no less than 5 years to reach the 2030 UN NTB target and declaration, African countries like Uganda are still battling stigma and discrimination on top of the high costs of care and treatment.
Apart from the medicine, they incur a lot of expenses, and some of them actually may spend more than 20% of their annual income on a TB patient. So that one means that many people, when they get this challenge, they are going to go into economic depression. Then the patient, if he's supporting any activities in the family, you're the breadwinner, many people are going to suffer.
According to the World Health Organization, TB costs the global economy over $1 billion annually. The burden of TB on families and the economy is immense. It affects productivity, reduces economic growth, and increases healthcare costs.
And even the country incurs a lot because we input a lot to treat these patients. For example, one who has a drug-susceptible TB, they may be spending about 1.4 million on this patient before the patient gets cured. That's a lot of money. When it comes to drug-resistant TB, the money multiplies. It goes up to 4 million, a lot of money. So we want to say this, that TB affects us socially, economically, and it's a big burden.
A report by the Minister of Health in Uganda indicates 40 people succumbing to TB every day. The spread of tuberculosis is worrying, with law stakeholders in Uganda perplexed over the increasing prevalence of TB at the time they are expecting total reductions.
Let us end TB by 2030. We have to do whatever it takes. And one of the issues is to engage everybody. We need to make sure everybody knows they are a stakeholder in ending TB. That alone, once achieved, I think we shall go a long way. So we may not achieve it by 2030, just like has been the case with many diseases and targets.
TB disease has been in existence for a long time, but has had less attention compared to other pandemics like HIV, AIDS. 1 million people die every year from TB-related ailments. There are several types of TB, including pulmonary TB, which affects the lungs, and extrapulmonary TB, which affects other parts of the body. We also have drug-resistant TB, which is a growing concern. The Uganda Stop TB Partnership Task Force has been holding a knowledge management meeting with different media personalities as journalists, celebrities, and artists in Mukono district.
One of our biggest challenges in the TB world, talking from a civil society perspective, is the limited knowledge or awareness about TB among our people. And when you look at the role of the Uganda Stop TB Partnership, the secretariat staff may not be able to go down to the lowest person, but we ride on the current structures that we have in our communities to reach out to the lowest person, to the lowest unit, and that is the family and the individuals at household level. How do we get there? We may not be able to move from house to house, but we believe that working with the reporters and artists, we can get to our people.
We need to increase awareness about TB, improve access to diagnosis and treatment, and support families affected by the disease. By working together, we can reduce the burden of TB on families and the economy. TB is a serious disease that requires urgent attention. By understanding its types, cost implications, and economic burden, we can work towards a TB-free future.
Health is all over. It is not like politics. Health, it is for all of us. Please take time if you want information about maybe communicable diseases, for example, tuberculosis, malaria. Before you put it out, contact the right responsible people, maybe program manager, carer, or they will be able to give you. Information is available even on the Ministry of Health website, on Uganda Stop TB Partnership website, and other partners.